Talofalawa, this is Pacific Waves from RNZ Pacific. I'm Susanna Suiswitki. Coming up,
a certain set of values that don't recognise housing as being a human right.
1 in 1,000 going without shelter in New Zealand. Also,
we need targeted treatments for Māori and Pacific people. Does that make sense?
Pacific people lack timely care following a heart attack, and mother and son are standing again in the Bougainville elections. In Aotearoa, an advocate for youth homelessness says Pacific people are disproportionately struggling with housing affordability for a range of reasons. Latest government figures show the Pacific unemployment rate is 12.1%, more than double the national average. Research from the Salvation Army last month also showed 1 in 1,000 people in the country are without shelter. I caught up with Manaki Rangatahi youth advocate Brooke Stanley. Kia ora and talofalawa, Brooke. Thank you so much for coming in to talanoa about homelessness, which we've seen a spike in Auckland, a 90% increase, but as you've mentioned before, there's been spikes in other regions. But from a Pasifika perspective, why is it so bad for that community?
Thank you so much for having us on the show today. And I think there's a number of things that have contributed to the increase in homelessness in the cities and across the regions. From a Pacific perspective, though, I think it's impacting our communities a little bit more severely than it is other communities. And that's to do with socioeconomic status, rent being one of the highest in the world, and also not having enough public housing or even affordable housing, I think. There's a whole bunch of government decisions that have been made as well that have also contributed to the increase in homelessness. I mean, homelessness doesn't manifest in a silo. And so, successive government choices and policies have contributed to the increase, but it's been made worse with this current coalition government.
I'm going to get back to you on the government's decision. You've pointed out the flaws in the system. What are you doing on the ground to address those problems?
So I work with Manaki Rangatahi, which is the only youth homelessness collective in Aotearoa. So we provide a space for youth service providers and youth housing providers to come together to mitigate youth homelessness, working across different spaces to ensure that rangatahi are housed, while also advocating for systems change.
Could you give us an example or a success story of a youth that you've worked with and they've managed to secure housing?
It takes a lot, I think. I think we don't often, we might not be aware or even recognise that it takes a lot of love and care and support, actually, of rangatahi to get them to a place of feeling well enough in themselves to be able to look after themselves, actually. I think Manaki Rangatahi, there are different organisations that we work with that often have supported rangatahi into a place of being able to care for themselves. But it requires, like I said, a lot of work from organisations, from government departments to having the right people in the right place at the right time, and also ensuring that along that journey that rangatahi is supported, loved and cared and reminded actually of their own voice and their own power.
Earlier in our talanoa, you mentioned that the coalition government, their decision has contributed to this homelessness spike or crisis. Have you had those direct conversations with them? Could you collaborate with them?
We haven't reached out to them, or I know that our po Arahi has put out several comms to ask to meet with them, to discuss some of the things that we're seeing on the ground, to talk about alternatives to emergency housing, but nowhere yet to meet with them directly. I know there are some member organisations and other organisations within the youth homelessness space that have been in contact or directly talking with government. And I know that there was a decision made last week for them. They're looking at, they're going to relook at some of the eligibility criteria for emergency housing. And that's come off some conversations based with Auckland City Mission and some other organisations that are on the front line. But I think it's hard right now for them to kind of understand the impacts of their decisions, especially I think when there's a lack of accountability or responsibility wanting to be taken for what we're seeing right now.
Have they put forward any solutions, and do you think they're effective?
I think it's successive government choices and policies that have contributed to the increase in homelessness right now. And I think that those policy choices and decisions are actually underpinned by a certain set of values that don't recognise housing as being a human right. We're looking at a politics of ego, of competition, of division, of greed and profit, instead of kind of looking at values that underpin our politics and decision making that should be grounded in manakitanga and aroha, in compassion, care, sharing. Honouring te tiriti would be a nice start, I think. I think it's really important that our leaders just not only talk about these things, but also have the actions and policies that reflect those values.
Okay, so what solutions is your organisation offering that's not currently seen in the government?
Yeah, I think there are, honouring te tiriti would be a good start. I think we're also, ensuring that housing is a human right, that there's a plan in place actually to address not only youth homelessness, but also homelessness in general. I think we need to look at the different contributing factors, actually, the structural inequities that also contribute to homelessness, and ending homelessness. Like, we can't talk about ending homelessness unless we also talk about ending poverty. And so, because we know that the two are intertwined. Working with community housing providers to ensure that, housing and the services that are provided for rangatahi and people and communities in general are actually culturally fit for purpose, and they're connecting in with the communities that have actually been forgotten about or underserved by our current constitution.
Cool. And just to wrap up our Talanoa, Brooke, what's your message to those who are on the brink of homelessness or who are struggling to find secure housing?
Oh, gosh. Yeah, I don't... I don't really... Sorry. I don't really know, what I would say. I don't really have any words, actually. Sorry. I don't know what I would say, actually, to anyone who is about to experience that or is experiencing that. I don't know. Sorry.
It's okay. I mean, it's quite a bleak season at the moment.
No, yeah.
Thank you, Brooke. Any last words?
No, I'm all good. Thank you.
A new research report says Māori and Pasifika die from heart disease on average 10 years younger than Pākehā. Meanwhile, Pasifika feature prominently in hospitalisation rates and across a swath of disease prevalence levels and mortality measures. Auckland University Professor Sir Colin Tukuitonga says that Pacific lack timely care after a heart attack, and these inequities need to be tackled fast. Kaya Selby asked him what that inequity looks like.
If you look at the ethnic groups of people with heart failure that get admitted to the hospital, it's 4 times higher in Pacific people. if you look at the age of those people that get admitted to hospital with heart failure, on average, Māori and Pacific people are 10 years younger on average. These people are not getting the care that they need, and so the coalition government has argued repeatedly for treating everybody the same, who have different risk factors for heart disease isn't going to be helpful. We need targeted treatments for Māori and Pacific people. Does that make sense?
Yeah. So can you walk me through what targeted resourcing might look like?
So, for example, more interventions for smoking cessation, better access to primary care by providing better subsidies for Māori, for example, to see the GP earlier. But the coalition government has always argued that we shouldn't target services on the basis of ethnicity. Clearly, this report is saying that both being poor, socioeconomic conditions, and being Māori or Pacific are independent risk factors, which argues for targeted interventions. I guess the report is saying that we really need to have better targeted services for Māori and Pacific people. Otherwise, we'll just keep seeing the same things that we've been seeing over the last two decades. I suppose as a country, I think it's a worry that we don't have the workforce that's required. So one of the big sections of the report talks about cardiologists. We're short of cardiologists, particularly in certain parts of the country. So if you live in rural New Zealand, you're less likely to get heart treatment, for example, because of the shortage of workforce. I guess what the report authors have pointed out as well.
5 years ago, Therese Kaitawara chose to go down the same path as her son, Emmanuel Carlos Kaitawara, and seek a seat in the autonomous Bougainville Parliament. Both were successful and both are standing again in the new poll on 4th September. Therese, a long-time advocate for women's rights, is aiming to retain her South Bougainville Women's Reserved seat, and Don Wiseman asked her how the last 5 years have gone.
Well, it's been quite a journey.
What would you say you've achieved in that 5 years?
In these last 5 years, I think because I am mostly, focused on working with women, I feel that I have achieved quite a bit. I've worked hard trying to raise women and to a standard where they can economically sustain themselves.
What were you doing that would help that happen?
Right, that's a good question, yeah. There's quite a few things that I have actually been helping the women with, especially helping them set up projects, like livelihood projects that women actually work with day in, day out, something that they know how to handle, they know how to manage.
You're now going into a second election in your South Bougainville women's seat. What do you expect and what are you hoping for?
I am actually recontesting because I'm actually defending the seat that I am sitting on. And my dream is to continue on with the work that I have started already. I just like to, brief you a little on what I am doing. I like to just move on with empowering the women, encouraging them to continue supporting the journey that we have. Just want to continue to encourage my women, to strengthen them, to continue to support the political independence and the economic development of Bougainville.
Have you noticed a change? Have things changed over the 5-year period?
It has taken quite a while, and the change that is actually coming through has taken, quite a bit of time, but it is coming through and we are moving little by little. But, change is sure and it's certain. It's happening. There is change happening. I see that in my women as well, as I continue to encourage them, empower them, do capacity building and all that. And through the help that I continue to give. There's more women coming in through SMEs and all that. Yeah. With the gender balance in the second-tier government, there's a lot of changes that has happened politically and economically.
The government has its eye on independence for Bougainville by 2027. Amongst your constituents, how important is that, do you think?
It is very important. I see that in the region that I represent, that is taken really seriously amongst the women community or even the community as a whole. That's taken seriously. And that's been worked on. The area that I actually am responsible for, everything that I do is towards building my women towards that journey. And that is recognized throughout because there's quite a lot of work that we do, quite a lot of awareness that's been going on, and everybody knows where we are heading.
That's Pacific Waves for today. For all episodes, head over to rnz.co.nz/Pacific. We're also on Spotify, Apple and iHeartRadio. From myself and the RNZ Pacific team, tō whā soifua.